The examination room at Volunteers for Wildlife is a bustling hub of patient activity. In the height of our busiest season, more than 20 new animals a day will be examined by our team of experienced licensed wildlife rehabilitators. Within these walls, our rehabilitators provide life-saving care to countless patients. They relieve pain and suffering, and they hope for a brighter future for Long Island's wildlife. Let's head behind the scenes for the recent intake of an American robin admitted on March 25th after a cat attack. Upon arrival at our center, our new patients are given a brief check for immediate life-threatening conditions and are then moved to a safe holding carrier while they are given time to calm down from their trip. Between the stress caused by their injury, capture, and then a trip to our center, these animals have already had a very rough day. Once calm, the first step of our exam is to get an accurate weight on our patient. This weight serves as a baseline and helps us to better track the animal's health and their progress at our center. This American robin is a good weight for his species, weighing in at a hefty 81 grams, 5 grams above the average. Our patients are checked methodically from head to toe to be sure no injuries are missed during the exam. Eyes are checked for vision and discharge. We look at the ears for parasites and signs of trauma, and beaks are checked for fractures and alignment. In order to assess the bird's level of hydration, our rehabilitators open the mouth to assess the mucous membranes and the inside of the mouth. If the mucous membranes are pale and tacky, this is a sign the bird is dehydrated and will need fluid therapy. The mouths of these birds can be tricky to open, especially when wearing protective gloves. Now that examination of the robin's head is complete, he is wrapped in a towel to help keep him calm and restrained throughout the remainder of the exam. Our rehabilitators use a combination of sight and palpation to continue the examination. They look and feel for any abnormalities, injuries, or asymmetry. The bird's body condition is assessed by palpation of the pectoral muscles around the sternum. This robin is very well muscled, an indication he has been finding food successfully and has likely not been injured for long. During palpation, a rehabilitator found an area of abnormality along the right side of the pectoral muscle underneath the wing. Now that an area of concern has been found, our rehabilitator needs to take a closer look. However, the bird's body feathers are dense and present a big challenge to seeing the area. Our rehabilitator requests an alcohol prep pad from her assistant. The alcohol is not used to clean the wound, as that would be tremendously painful for our patient. Instead, the surrounding feathers around the area are wet down, which helps her to better visualize the injury. She finds a large puncture and a severe amount of swelling and bruising to the right side of the pectoral muscle underneath the wing. The assessment of the bird continues with examination of the right leg. No fractures can be found, and the bird has a good range of motion in both the leg and the foot. The bird is then wrapped for assessment of the left side of the body. Fortunately, the left side of the bird checks out well. The bird is in great feather condition, there are no fractures, and there are no other injuries on that side of the body. Here you will see the robin has dropped some of his body feathers. Unfortunately, this is not uncommon. When attacked by cats and other predators, these birds will often drop body feathers in order to avoid predation to allow them to survive. Now that his examination is complete, the robin is placed back in his holding carrier. He is dosed for several medications necessary for his survival. In addition to medications to reduce pain and swelling, he is dosed with an antibiotic to prevent infection. Due to a high prevalence of Pasteurella bacteria, cat bites are often lethal in wildlife. These antibiotics are necessary to give this patient a fighting chance of survival. With antibiotics and pain medications administered, it is now time to thoroughly clean the deep puncture wound on this bird's chest. The wound is flushed thoroughly with sterile fluids to remove as much bacteria as possible. Once clean, the wound is dried and a topical antibiotic ointment is applied. One of the most important parts of our patient's recovery is providing him with a quiet place to heal in as stress-free an environment as possible. Our adult songbirds, like this robin, are housed in our isolation room. We enter this room only twice per day for the care of these patients. This robin's enclosure is made of mesh, and you actually may recognize it looks like a laundry hamper. Us rehabilitators are very creative in coming up with housing solutions for our wildlife. The enclosure is set up with natural branches and foliage to provide cover. As flock animals, robins enjoy the company of others. To help mimic the feeling of company, we have provided him with a mirror to keep him calm throughout his rehabilitation. The final step in our patient's setup is to make him a diet specific to his species. Robins eat both berries and fruits, as well as insects and worms in the wild. Amandine, our wildlife rehabilitation apprentice, carefully slices a selection of fruits to accompany this bird's insects. Throughout his recovery, his weight and his food consumption will be monitored closely daily. Since the robin arrived at our hospital in such good body weight, our goal is to release him in the same condition. After a long and stressful day, our patient needs to rest. He is placed in his enclosure, and the enclosure is covered to give him privacy. While this bird has a very severe injury to overcome, we are glad to be here to help him on the road to recovery. We hope you enjoyed this behind-the-scenes look at our hospital today. Remember, if you have cats at home, the best decision you can make for wildlife and your pet is to keep them safely indoors. Thanks for tuning in, and we'll see you again soon.